the topic of my presentation again is cerebral palsy and perinatal asphyxia, and we shall be discussing the case laws in our Kanun. This is the first case, Dr. Mrs. Indu Sharma versus Indraprasth Apollo Hospital and Dr. Suhani Verma on 22nd April 2015. The complainant was Dr. Indu Sharma. She was a BMS doctor who conceived after years of infertility. Patient was admitted in the hospital in 1999 June. After spontaneous rupture of membranes, induction of labor began with high-dose syntocinon shortly thereafter. Despite signs of fetal distress, that is fetal heart going to 80 beats per minute, no immediate cesarean section was performed. The baby Nishtha was delivered by emergency cesarean around 2 to 3 a.m. on 12th June 1999. Post-birth, baby did not cry for 5 minutes, suffered birth asphyxia. There were scissors and required NICU care. Feeding was problematic. Subsequent scans and expert obedience, including CT scan, MRI, and a 95% disability certification by AIMS, confirmed severe brain atrophy and cerebral palsy. The outcome was that the child lived with severe disability for 12 years and passed away on 15th January 2012. So the relatives had the allegation. They filed the case in 2013. That is 12 years after the baby was born, 13 years. The allegation was that there was delay in performing cesarean section following rupture of membranes, alleged to have extended beyond medically acceptable limits, administration of excessive oxytocin leading to fetal distress and asphyxia, alleged tampering with or withholding of critical medical records, especially CTG tracings and neonatal records. They sought INR 2.5 CR in compensation, rupees 5 lakhs for mental agony, and 25,000 for litigation. The defense on behalf of the hospital was that they claimed the duration of induction was 17 hours, which was within acceptable time, and delay was at patient's request as she wished to wait despite labor being non-progressive. They argued on oxytocin use that the drug wasn't hyperstimulating or causing fetal distress, and the fetal heart rate never dropped dangerously. There could be alternate causes. They suggested cerebral palsy could have been due to antenatal origins, noting that a large proportion of such cases are not due to intrapartum events. Timelines and procedures, they claimed that the consent issues delayed cesarean section and that induction failure justification applied only after 24 hours. They denied tampering, though records were produced at a much later stage in the proceedings. Now, when the case records were studied, the outcome was that the negligence was established. The commission found evidence supporting delayed cesarean section, excessive oxytocin administration, and concealed medical records indicative of negligence, held that a person may lie, but the documents will speak the truth, highlighting failure to follow standard labor management protocols and poor record keeping. A compensation of rupees 80 lakhs was awarded on behalf of the hospital, plus 10 lakh punitive damages, and doctor had to contribute rupees 20 lakhs share of compensation. So it was a total of 1.1 CR. The verdict was guilty. This is the second case, Santokha Durlabhji Memorial Hospital versus Vikas Arya on 27th December 2023. Case was filed in 2003 and decided in 2023. Srimati Shweta Arya, the wife of complainant who was pregnant, sought medical consultation with Dr. Preeti Sharma. On 23rd October 2001, she expressed concern as regarding decreased fetal movements. However, OP2 assured that this was within normal spectrum. On 29/10/2001, she was admitted for delivery. Umbilical cord was wrapped around the child's neck, resulting in post-birth convulsions. Subsequent CT scan revealed that the child was afflicted with cerebral palsy. Consumer complaint was filed in 2003, alleging medical negligence and sought rupees 55.66 lakhs in compensation. The allegation was that medical negligence and deficiency in service resulting in lifelong disability for the child. The defense was that the child's condition was due to genetic or congenital defects, not delivery-related issues. The mother only had limited consultations with OP and did not undergo advised ultrasound. That is, she was advised ultrasound Doppler, but she didn't undergo it. The State Commission partly allowed the complaint, awarded compensation of rupees 50 lakhs. 2 cross appeals were filed before NCDRC. Now, as far as the NCDRC analysis and decision is there, medical evidence and records. The medical board's opinion was inconclusive and could not definitely attribute the child's condition to negligence. The hospital failed to produce complete medical records, raising credibility concerns. There were discrepancies in documentation such as alterations in drug dosage records, insufficient monitoring, and a lack of CTG and detailed delivery logs pointing to possible negligence. Compensation assessment. While the State Commission's compensation was significant and recognized the child's lifelong disability, the NCDRC found the awarded amount reasonable and saw no legal grounds to increase it given the available evidence. So the outcome was both appeals were dismissed. The order of State Commission dated 15th March 2017 was upheld and the earlier compensation directives remained unchanged. The compensation of 50 lakhs plus interest plus medical expenses plus costs stood as the final award. The verdict was guilty. The third case is Srimati Preeti Baghel and Om Nursing Home and others on 20th March 2017. The background is that pregnancy was confirmed in October 2014. Sonography tests till January 2015 reported normal results. By 31st May 15, a sonography showed a single loop of umbilical cord around the baby's neck, deemed non-concerning by the doctor. On June 1, 2015, the complainant went into labor. Despite requests from the patient and her family for cesarean section due to pain and concern, the doctor delayed, insisting on attempting normal delivery. Complications arose when another patient required attention. The doctor reportedly left, delaying the procedure by 20 to 25 minutes. The baby was delivered by cesarean section only after the delay, but suffered severe hypoxia due to prolonged judgment and delays. The newborn was not active at birth and required immediately ventilatory support. The child suffered cerebral palsy and was expected to remain permanently disabled, requiring lifelong care and therapy. This was supported by MRI and expert neurological reports. Now, the allegation on behalf of the patient was that the doctor's refusal to perform an early cesarean section compounded by delays and lack of emergency readiness constituted gross medical negligence resulting in catastrophic harm to the child. The defense argued that the patient was not fully cooperative, complication was unforeseeable, and the delivery staff followed standard medical protocols. Asserted that signs of fetal distress were absent, medical facilities were adequate, there was no proven nexus between the doctor's conduct and the child's condition. The defense also questioned the credibility of some medical records and expert opinions submitted. The commission, in its outcome, partly allowed the complainant, recognizing medical negligence and awarding 8 lakhs plus 12,000 legal costs. Bulk of compensation requested by a complainant was not granted due to insufficient proof of incurred expenses and a few inconsistencies in documentation too. The fourth case is Baby Geetha versus Cosmopolitan Hospitals. Appellant number 1 was born at the Cosmopolitan Hospital, Thiruvananthapuram, under supervision of Dr. M. Subhadra Nair, consultant obstetrician gynecologist, and respondent number 3, Dr. G.R. Nandkumar, consultant pediatrician. Expected date of delivery was 6 December 89. On Nair's advice, patient was admitted on 8th December, labor induced on 11th December. In spite of Pitocin, the appellant too did not develop labor pain. As such, on 13 November, Pitocin drip was repeated twice. The patient then induced by artificial rupture of membranes. On 13th December, the patient delivered a child. After the birth of the child, even though the mother complained about incessant cry of the baby, tremors and jerks of the baby not suckling, etc. to the doctor, no attention was paid. Within 16 hours after discharge from the hospital, the child had to be rushed back to the hospital with high fever, convulsion, and breathing difficulties. The baby was provisionally diagnosed as suffering from septicemia and referred within 5 hours on the same day to SAT Hospital, Thiruvananthapuram, to be given intensive care in the neonatology department. Tests were confirmed that the child suffered from birth asphyxia, which resulted in hypoxic ischemic encephalopathy. This has resulted in lifelong mental retardation of the child, epilepsy, and physical disability necessitating custodial care. It is alleged that the Pitocin drip was not monitored properly. It is submitted that the contraction frequency, intensity, and duration and timing of mother under fetal heart rate were not observed and monitored closely. As 1.5 hours of Pitocin drip, little labor pain was noticed. ARM was done to increase the uterine contractions. The rupture produced only 1 ml of amniotic fluid, that too meconium stained. It is alleged that between 8:15 to 12 noon on 13 December, Dr. Nair did not see the patient and that there was total negligence. It is argued that the pediatrician was not brought in time of the delivery and immediately after delivery. Pediatrician saw the infant only half an hour after the birth, and then there were no direct communication between the obstetrician and the pediatrician. Complaints of mother about incessant crying of the baby and tremors of the baby were not attended to, nor were these put on record. As per Pitocin drip chart, the cervix had dilated only 4 cm at 12 noon. It is argued that the patient never reached the second stage, but still the delivery was forced. No resuscitation measures were taken to minimize or treat the fetal distress or asphyxia. It is argued that when there were so many clear indications to distress of the fetus, respondent number 2, Dr. Nair, should have gone in for cesarean section to release the distress to the infant, which was not done. The outcome of the case was guilty. There's another baby, Ramya versus Dr. Aruna Reddy, which was held in state commission. Baby had brachial palsy. I mean, this is not related, but I just quoted. A compensation of 1.7 lakh was given. M. Jiva V. R. Lalita. This is in NCDRC, Tamil Nadu, where rupture of uterus was there, baby expired. A compensation of 2.5 lakhs was awarded. Now, this is another case. The complainant number 1, Mrs. Sunita, got herself registered with respondent hospital on 4th month of her pregnancy. She reportedly said that in first 4 months, everything was normal. The complainant got admitted in the respondent hospital, that is St. Stephen's Hospital, in 2010, delivered a male child. The complainant was never informed that the newborn child had been shifted to nursery owing to deficiency of oxygen. It is only 3 days after delivery, doctors of respondent hospital informed the complainant that the condition of the child is not good and he has suffered brain hemorrhage. As per oral opinion of the doctors, this was result of medical negligence on behalf of defendant. During the process of delivery, there was fetal distress. The doctors of St. Stephen's Hospital did not decide to abort the process of delivery and to take up the patient for cesarean section. This fact clearly shows that the doctors of Stephens did not monitor the patient as the fetus later developed distress. The child had perinatal asphyxia. The cause of asphyxia is non-availability of pediatrician at the time of delivery and non-competence or negligence of pediatrician. The defense was that the complaint has been filed by complainant with sole intent of covering up their alleged criminal act of abandoning their newborn child. Despite orders passed by Delhi Commission for Protection of Child Rights, the complainant did not care to visit her child and take him with her. The OP hospital has further stated that during delivery, the fetus had suffered slight distress. However, resuscitative methods were taken and the child was revived. Further, medical board was constituted on examination, they came to the conclusion that the child was fit to be discharged from the hospital and thus no negligence on their part. OPs have also denied the contention of complainant alleging negligence on the part of the hospital. So the outcome was that the expert opinion obtained from Lady Harding found that the course of treatment by Stephens was acceptable, that is, no apparent negligence from hospital was there. The Delhi Medical Council also found that no medical negligence was there. It noted some discrepancies, for example, in CTG and fetal monitoring, but held that prima facie the hospital had not committed negligence. The State Commission accepted the complainants as failed to meet the burden of proof of negligence. There was no proven malafide, no clear departure from accepted medical practice. As a result, the commission complaint was dismissed, no compensation was awarded, and the verdict was not guilty. This is the last case. The plaintiff was patient in defendant hospital in 1995. She was admitted for delivery under Dr. Rani. Baby was born asphyxiated, had to be shifted to NICU. Doctor did not come personally. That was the complaint. Dr. Rani, on the other hand, stated that she was immediately near the patient and Then finally, she had to apply forceps to deliver the baby. Additionally, defendants provided service free of charge since the father of the child was an employee in the hospital. Lastly, the status of limitation had passed, so a case no longer being instituted against them. The second defendant, the pediatrician, stated that at the time of discharge, it was clearly explained to the family that the child would have neurological issues. The neurologist also attended to the baby and explained the condition to the family. The court stated that the complainant could not provide sufficient medical records despite taking continuous treatment for 7 years, and that the patient's documents were no longer available for examination after all this time. So the case was dismissed and the verdict was not guilty. So important precautions ma'am has already discussed. I don't think I should repeat them. And the Jacob Matthew versus State of Punjab, this is always discussed. So finally, standard of care, a medical professional is liable only if he fails to So a medical professional is liable only if he fails to reach the standard expected of an ordinary competent professional in that branch. Mere error or complication does not suffice to establish negligence. Informed consent, it is necessary to inform the patient of significant risks and obtained consents, but non-perfection in disclosure must be judged in light of medical practice and information available at the relevant time. Risk and complication, surgery, especially in complex cases, involves risk. The court recognizes that even with reasonable care, bad outcomes may happen. Those do not automatically imply negligence. Burden of proof. The complainant must clearly prove deficiency or negligence. The medical professionals are entitled to protection unless it is shown that they departed from the medical opinion and standards at that time would be deemed acceptable. Liability and discharge. The hospital's responsibility does not automatically extend indefinitely post-discharge, especially if follow-ups are missed, unless the hospital has continuing duty and was informed or aware. Thank you very much.